Mantasha Banu, who resides in nondescript village of Atesua in Uttar Pradesh, was 28 weeks pregnant when she went into labor. Her neighbors called an ambulance to shift her to a hospital. The ambulance, though, never showed up. Mantasha Banu lost her baby. Medical workers have reported a significant increase in stillbirths as the COVID-19 pandemic continues to put a strain on rural health services in India, which is one of the worst hit countries in the world. The COVID-19 pandemic has put economies across the globe in unexpected hibernation as governments scramble to flatten the curve. The lockdown, however, came with a critical trade-off, especially in India, where more than 2/3 of the 1.3 billion population resides in rural settlements. One stratum of the population that has faced the brunt amidst this health crisis are the expectant mothers. Non-institutional delivery has been a compelling decision due to inadequate ambulatory services and public transport during the lockdown. Like Mantasha Banu, several such instances have emerged across rural India where women have struggled to reach a healthcare facility due to restricted transportation. Expectant women in advanced stages of labor have reportedly been refused care by private clinics and even government hospitals that have pushed them to travel several kilometers to deliver despite being in pain. Increased risks of maternal infections and mortality due to the absence of timely care are pushing India further away from the Sustainable Development Target of achieving a double-digit maternal mortality ratio from a current 3-digit rate. According to the United Nations, almost 2 million babies are stillborn every year, that is, 1 every 16 seconds. The vast majority of stillbirths, that is 84%, occur in low and middle-income countries where basic neonatal care could save hundreds of thousands of lives every year. The United Nations has now warned that the COVID-19 pandemic could add another 200,000 deaths to the devastating toll. To make these inequities graver, the unprecedented times have led to the suspension of antenatal checkup for pregnant women as well as door-to-door outreach programs that include necessary immunization. Infant and child health is another extremely critical policy concern, even more so in times of a pandemic. These services have been offered at the village level in India, generally by the frontline Anganwadi workers, that is AWW, and accredited social health activists, that is Asha community health workers, due to unavailability of affordable healthcare facilities in the villages. Although the government's mandate was clear in suspending these prerequisites, unfortunately, these measures were not juxtaposed with alternatives. Renu Singh, an Asha coordinator who has been overseeing 26 villages in Uttar Pradesh, including where Banu lives, for nearly 15 years, said it was the first time maternal care had been so badly disrupted. Between March and August, when India was under months-long national lockdown, she said there had been 22 stillbirths in her area, about 4 times more than last year. On an average, India registers approximately 77,575 live births per day, and these statistics reflect the gravity of the current situation for the expectant women, who are not only struggling to reach the hospital, but are also apprehensive of the high risk of infection. Further, more than 40% of the expectant women in rural areas rely on AWW or Asha for maternity and childcare services. AWW or Asha workers have now been deployed to handle the COVID-19 situation. As a result, pregnant women, especially in rural settlements, have lost access to their last resort during their crucial months. The nationwide lockdown and lack of comprehensive guidelines for maternal care have left many expectant and new mothers in the lurk. A few immediate and concerted policy measures are therefore critical to address the neglected maternal health of India's rural women while weathering the current outbreak.